Hi, this is Melissa Cheplic from NADD. The NAD is an association for persons with intellectual disability and mental health needs. So dual diagnosis is a term used to describe the presence of both an intellectual or developmental disability and the symptoms of mental illness. So it refers to the coexistence of symptoms in both disability and mental health. And the dual, or the two, describes challenges in both domains, but sometimes people experience more than two diagnoses. For example, a person might have a diagnosis of autism or Down syndrome and then also experience co-occurring anxiety and depression, or a mood disorder and trauma. So just as the rest of the population, people with intellectual and developmental disabilities experience mental health challenge, and this can occur at any time across their lifetime. But research has shown we're likely to experience that secondary psychiatric disorder. So studies have found that about 1/3 or more of people have had significant behavioral or mental health needs that require clinical support. This may or may not be associated with a formal diagnosis, but about 50 to 60% of adults with developmental or intellectual disability will have a co-occurring psychiatric or mental health disorder over the course of their lifetime. This is information from NADD. This is also consistent with the National Core Indicator data, that's self-report data used across states to assess the quality and outcomes of developmental disability services provided to people with disability and their families. And so that survey data from self-report says 55% identify a secondary diagnosis. So that's pretty consistent. About 50 to 60% of people with disabilities, intellectual or developmental, will have that secondary mental health condition across their lifetime. There are several circumstances that contribute to mental health disorders in people with intellectual and developmental disabilities, and just having a disability in general makes people more vulnerable by having less choice, having fewer resources and opportunities, more restrictions on day-to-day activities. But there's also some more real specific biological and social and psychological risk factors that make people more likely to have that secondary mental illness. For example, people with disabilities experience brain injury and seizure disorders, vision impairments, hearing impairments. They may take multiple medications. This makes life more difficult to navigate, makes anxiety and that secondary mood disorder more likely. People with intellectual and developmental disabilities have prolonged exposure to negative social conditions, segregation, victimization, rejection, unemployment, underemployment, restricted opportunities, and trauma. Additionally, there's negative attitudes and expectations, a stigma, prejudice, poor inappropriate supports. There's also family challenges across the lifespan, from that initial diagnosis and onset of disability to people with disabilities who have younger siblings who may surpass them in milestones like graduation and death of their parents that can trigger a mental health crisis. And all of this is, of course, further impacted by compromised social skills or maybe limited or negative experiences. So it's only within the past 40 years or so, which is actually not a very long time in our field, that professionals have really recognized that it's possible for people with intellectual and developmental disabilities to have that secondary mental health condition. But obtaining an accurate diagnosis for mental health in people with IDD has been and remains very challenging. Recognizing that mental health disorder is complicated by a number of factors. Primarily, some people with IDD may have poor verbal skills. So it's hard to communicate the symptoms that they're experiencing. If they have limitations in language, they may communicate these symptoms in other ways that are managed and treated as being behaviors. Screening tools rely on someone's description of their behavior or their symptoms or their awareness of their experience. May be hard for people with IDD. Sometimes a lack of observable symptoms or decrease in function is overlooked, and then we don't recognize mental health conditions, right? Some changes in behavior make caregiving easier. So caregivers and teachers tend to bring up problems that make caregiving harder. But if someone's life makes caregiving easier, they may not think to mention it. For example, someone who sleeps 12 hours a day, or their activity or their energy level is decreasing, it may take longer to recognize some of those symptoms, which are indicators of mental health disorders. So I think what we have to do is just be aware that these are real risks for people with intellectual and developmental disabilities across the lifespan, right? So it's pretty common for people with disabilities to maybe have difficulty with their behavior, but we want to recognize that these can be real symptoms of mental health that are affecting how they meet their needs. And sometimes mental health symptoms are overlooked, and this is common when observable behaviors become the focus of treatment and assessment. The underlying causes may go unnoticed. So we want to make sure that we're being proactive by recognizing those things that can potentially cause anxiety and stress and trauma in the lives of people with disabilities every day. And just think about ways to reduce overall anxiety and stress across different settings, both at home and in the classroom and in the community, by increasing certainty, reducing that uncertainty, putting expectations in place, giving people real toolkit things that they can do, like mindfulness and deep breathing and listening to music in a really person-centered way that's going to support them through transitions and support them through times when it might be more stressful and anxious, whether it's a particular time of the year, a particular time in their lives, or a particular thing that they find to be difficult, and just be more aware that these are real risks, and just to look below the surface and to not just see and treat everything as being a problem behavior that requires management, but really an indicator that there could be an underlying mental health issue that's expressed by a real need.